Hello, my name is Bob Phillips and I'm one of the members of the CCLG. I'm a paediatric oncologist at Leeds and I'm a researcher at the Centre for Review and Dissemination at the University of York. This little video is an update on the CCLG recommendations to do with the new coronavirus, which is known as SARS-CoV-2, and the disease it produces known as COVID-19. You'll all be very familiar with it at the moment as you're living through the experience of having it and having a child with cancer or who's had cancer within your family. Now, what we've done is updated our guidance on the basis of new research that's come along. This research has been generated within the CCLG, within the UK, and also by looking broader at the entire world's literature to do with children with cancer and the new coronavirus. What we found is what, in a way, we hoped, but what we feared wasn't true. What we found is that a lot of children that have had the virus have been absolutely fine. They've had a mild cold or even fewer symptoms than that. And no one that we have seen in the UK's experience has died of the coronavirus disease. Although there have been a couple of cases of severe disease, we think that they've also had other things going on at the same time. Now, we've put all of that information together along with an understanding of how it is around the world and how it is in the country, and then we've worked together as an expert group to try to understand that evidence and come up with some practical changes into what was originally said. What we'd like to do is to help you understand where those differences come from and what now are the new groups. There are still three groups really. They are the extremely vulnerable, the vulnerable, and the, for want of a better word, normal group. The extremely vulnerable group are those where we think that the disease, the new coronavirus disease, might still have significant problems, or where we have too little information to really tell whether there will be significant problems or not. And so the group that fall into here are leukemia patients in induction, so for ALL that's the first 4 or 5 weeks of treatment. Those patients who've had an allogeneic bone marrow transplant, that's like a traditional bone marrow transplant where you get cells from somebody else, and up to 12 months after that's been happening. Those patients who've had their own stem cells back, so for instance those who've been treated on some of the Ewing's protocols or for some of the high-risk neuroblastomas. For those patients, it's up to 6 months following completion of their autologous or their own cells back transplant. For patients that are on immunotherapies or antibody therapies, those are drugs that tend to end with the word MAB. For those patients who are on drugs that end with the word IB, so dasatinib and stuff like that. Now that one we're really not entirely sure about, but we haven't got enough data to say that they should be moved out of this extremely vulnerable group. And also patients who have relapsed or refractory disease and are being treated with chemotherapy. Now that's one of the most uncertain groups and ones that we really would expect you to be talking to your clinician about, because some of those patients will be receiving chemotherapy in a palliative way, in a low dose chemotherapy, but many patients will be receiving a very intensive form of chemotherapy as well. And so those are the patients where we really think that clinicians might have a slightly different view because they know the exact details of that child and their treatment. That leaves the majority of children on treatment for cancer in the vulnerable group. That's all the people with leukemia, with lymphoma, on normal chemotherapy, on chemotherapy for Langerhans cell histiocytosis, right up to the end of their treatment and 6 months afterwards. That we would say was the vulnerable time. We'd also put patients that are having replacement immunoglobulin, which might carry on past the end of that, into that group as well. But the big change for some will be that those patients who had radiotherapy across the whole of their tummy, or might have spleen problems or medicines to keep spleen infections away, those patients we think should be classed as normal. Initially they were put in the group because we weren't sure what would happen, but having amalgamated all of the evidence, we can't find anything that says that having a spleen that works slightly less well puts you at any increased risk when it comes to the new coronavirus. There are another couple of things that immediately spring to mind that have been being asked. That's how do we do shielding and what does going back into the vulnerable group means. So the extremely vulnerable group we would suggest should still do shielding, and that is trying to keep the household as much as possible not going outside. And that would mean that if school's open, then the siblings of the children do not go to school. As you have, I'm sure, been doing, limit the number of adults that go to work. It's a really difficult thing to do. We appreciate that. In the vulnerable group, you don't need to do full-on shielding. You can do sensible social distancing. You can do washing hands when you come back in and before you go out. You can certainly avoid meeting people and being closer than 2 meters to them. All that stuff you can definitely do. When the schools open again, we would suggest that siblings, and indeed the children themselves in the vulnerable group, would be okay to go to school. We understand that that might feel really just too scary at the moment for some families, and we would encourage you to talk to your clinicians about maybe the individualised risk of some of those individuals. And then children in the normal group, well, we would like you to act as normal as possible, and as that normal changes over the course of the next few months and years. We wouldn't recommend that you go off on 260-mile trips to a beauty spot and back again, but we would recommend that everybody takes the opportunity in the vulnerable and the normal groups to go outside and exercise sensibly, staying away from everybody else. While we're on the subject of social distancing, there's been quite a lot of stuff about face masks. Now, face masks, as we talk about them, are medical devices intended to protect the wearer from catching things. The sorts of face coverings, and these are the fancy sock things and the stuff that people have been knitting, that we are talking about now are more about preventing you accidentally spreading the disease to other people. And so certainly if you're going to go into an environment where you can't be 2 meters from other people, for instance a bus or a train, then we would advise that you wear face coverings, and everybody else as well actually. We know that there's been a lot of noise in the media about adults from black and minority ethnic groups having a lot worse outcomes than white adults do with the COVID-19 disease. Having looked at the data that we have for the children and young people being treated on cancer, we can't see that, but the numbers are very small. So we can't be absolutely certain that it isn't there either. What we would like you to do, if you are worried about that, is to talk to your clinicians to understand what more you might be able to do. Finally, we would like to talk a little bit about going back to school. Going back to school seems like a very big and a very scary thing for a lot of people at the minute. And it might be that you just can't make that step and send your child or your child's siblings back to school at the moment. We do understand that. All of the data that we have is reassuring, and with the precautions that are being put in place, we would be happy for the majority of children in that vulnerable and in the normal group certainly to be at school. Hopefully this has made some of our new guidance a little bit clearer. We know that there will be questions, and you're more than welcome to put those questions in the CCLG parents group, and we'll try and answer them over the time. We might even do little videos explaining any ones that keep going up and down again. Thank you.